Well, the COVID vaccination campaign is going really well. At the moment, we've done about 15,000 or more first doses of people, and we're very comfortable that we're meeting the rate that the vaccine's coming into our hands, and we're getting it administered as quickly as we can. We've been working our way through the very highest priority groups, so we've been doing the over 80s, especially those people living in care homes. People look after them, and as people will know, NHS and care staff. Well, vaccines work by exposing our immune systems to what are called antigens, which are usually proteins which are on the surface of the virus. You may have heard about the spike protein, and this is the one which has been targeted. So these vaccines work by having a little snippet of the genetic code from the virus, which is injected into our cells, which means that our cells then produce these spike proteins. So there's no actual live COVID virus in the vaccine or anything, but these little protein spikes are enough to kind of trick the immune system, if you like, into thinking it's seen it before, so that if you were to be exposed subsequently to COVID virus, then you'd be ready for it. Well, people have been worried about the safety of these vaccines because, a year ago, or a little more than a year ago, we never even heard of this infection. So it's a reasonable question to ask. But what's happened is that it's been a real global effort, given that it is such a health emergency. And the steps which would normally take many, many years because they're done one after another have basically all been done in parallel at the same time. So we're very fortunate. We've got 3 vaccines now licensed in the UK, and hopefully even more on the way, which is a fantastic effort, really. But people can be assured that they have been rigorously tested. It's just that all these things have happened at once rather than a big long line of events. Well, there are 3 vaccines in license across the UK. 2 of them are being used here. The first one, which there was all the fanfare about just before Christmas, was the Pfizer vaccine, which is the one which needs to be stored in a fridge, and not just any, freezer, and not just any freezer. It has to be at -70, so very, very difficult to transport around. So this was the one which we used in the care homes and for NHS and hospital type staff. The backbone of the campaign is going to be the so-called Oxford vaccine made by AstraZeneca, which just needs to be kept in a normal fridge. So most people will be getting offered the Oxford vaccine. Obviously, in an ideal world, we'd like to do absolutely everybody at once, but we are limited by supplies because the manufacturers can only churn out so much. So there's a committee called the Joint Committee of Vaccination and Immunisation, the JCVI, which people may have heard about. And this advises all 4 UK governments about all aspects of immunisation policy, MMR vaccine, flu vaccine, absolutely everything. And they've been very, very clear about the priority groups. The people we were really most worried about was elderly people living in care homes, because it could be very serious and indeed fatal for these folks. So they were the very first priority, and the staff that look after them, and also healthcare staff to keep the show on the road in the hospitals and so on. We're now doing the 80s in the community, the 80s and up in the community, and once the GPs get started next week, into February, then we'll be working our way down through the age groups, and then the next interesting group, important group, is the shielders as well, because they do need protection as well. Well, we'll contact you. People will be prioritised according to risk, as we said before. So you'll hear from the NHS when to turn up and where to turn up. So please don't contact us to try and get an appointment. We will contact you when it's your turn. Well, we have 22 places across the whole of Dumfries and Galloway where vaccinations are taking place. Some of them are the same as we use for the flu vaccine campaigns, but we're very excited as well from next week that we'll be having the GP surgeries on as well. So it's going to be a mixed model depending where you live, but there'll be very clear instructions when you get your invitation where to go and when to turn up. Well, it's a very good question that people would ask, is it safe to go to these places? But I'd like people to be reassured that we've tried very hard to make sure that these venues all comply fully with COVID guidelines. One of the important things which has been going on, because as we said before, there are a number of general practices who are going to be taking part very soon as well. And a lot of work has gone on in discussions with primary care colleagues to make sure that A, the premises are safe, but also B, it's not going to impact too badly on their own services, because we're ongoingly very grateful to GPs and practice nurses and so on for all their efforts, because it's a very, very busy time for them. And, you know, we don't want to disrupt their services. But yes, it's very important that people turn up, please. I mean, don't let fear of, you know, mixing in public or anything put you off from attending for your vaccine. It's really important that you get immunised.